Hi and welcome to my presentation. I'm Ruth McKinlay and I'm talking about the effects of caffeine on short duration, high intensity exercise. There is a lot of interest in the subject of caffeine and sport. It is believed that caffeine may have a performance enhancing effect, and for this reason athletes are interested in caffeine for use as an ergogenic aid, something that can help them train harder and perform better. There is evidence to show that caffeine is beneficial in aerobic sporting performances. However, there is limited research concerning anaerobic performance and the findings are often conflicting. Caffeine was once banned by the World Anti-Doping Agency. The ban was lifted, however, in 2004 as caffeine is so widely used in most people's everyday diet through tea and coffee and chocolate, not to mention the numerous sports drinks and power bars on the market today. Some of the physiological enhancing effects identified in research shows that caffeine can work to stimulate the central nervous system. It has been shown to work as an adenosine antagonist, meaning caffeine blocks receptors for adenosine, a chemical which can relax the body and cause drowsiness. There's also been links to show increases in dopamine and adrenaline, which would increase energy and overall feelings of well-being. There is some links to caffeine on the musculoskeletal system in relationship to excitation, contraction, coupling of the muscles. To cut a long story short, this is saying that caffeine may benefit in delaying muscle fatigue. Research has found that caffeine has a performance enhancing effect in power outputs. Again, conflicting research. There are also results to show no effects from caffeine. The present study measures anaerobic performance using a maximum accumulated oxygen deficit protocol, or MAOD. Only 2 other existing studies use MAOD to assess the effects of caffeine on anaerobic performance. Both of these studies found an increased performance post-caffeine supplementation. The present study has 2 aims. Firstly, to compare results to existing MAOD studies, and secondly, to add to existing literature on the effects of caffeine on high-intensity, short-duration exercise. Based on the findings in the existing MAOD studies, we hypothesize that caffeine will improve anaerobic performance using MAOD. 12 university students participated in the study, 6 male and 6 female. The participants were all active and healthy with a varied level of training. MAOD was assessed over 3 sessions. Firstly, the progressive maximal cycle assessment was performed in 5 stages at 60-watt incremental workloads. The maximum oxygen uptake, or VO2 max, for each participant was determined. This was followed by a progressive submaximal cycle assessment, again over 5 stages at 30, 40, 50, 60 and 70% of VO2 max intensities. Exercise intensity was determined for each participant in order to reach 120% of their VO2 max. This was used in the supramaximal cycle assessment, which involved a 3-minute cycle at 60 watts, followed by a 2-minute cycle at 90 watts, and then an all-out cycle to exhaustion at 120% of their VO2 max. The supramaximal cycle assessment was performed without caffeine supplementation, and then 24 hours later, after 3 mg per kilogram of body mass caffeine dosage taken in tablet form. Equipment used to assess MAOD was a watt-bite cycle ergometer, a load Excalibur cycle ergometer. Expired gas analysis was measured using Parvomedics and Oxycon Mobile. Variables examined were anaerobic contribution, time to exhaustion, MAOD, blood lactate concentration both pre-exercise and post-exercise, and excess post-exercise oxygen consumption, or EPOC, was also measured. Statistical analysis was performed using descriptive statistics, mean plus standard deviation. Paired sample t-tests were used to identify any differences, and Pearson's correlation coefficient was used to identify any relationships between the variables. Microsoft Office Excel 2007 was used to perform data analysis. The results showed a decrease in anaerobic contribution. There was a small increase in time to exhaustion, a decrease in MAOD. There was a decrease in blood lactate pre-exercise and a slight increase post-exercise. The only significant difference was found in EPOC, with a significant decrease. There was a significant relationship found between EPOC and MAOD both in the pre-caffeine and post-caffeine trials. It has been shown in research that EPOC is related to anaerobic contributions. The significant relationship found in the present study between EPOC and MAOD confirms this theory. Now, the significant difference showing a decrease in EPOC could be related to the decrease in MAOD and anaerobic contribution post-caffeine, rather than as a direct influence of caffeine supplementation. In the post-caffeine trial, it was shown a decrease in blood lactate pre-exercise, however an increase in blood lactate post-exercise. It was observed that some participants consumed coffee in addition to the 3 mg tablet dosage. Some research shows that caffeine may inhibit lactate clearance. Therefore, the participants who had extra caffeine in their system may have been inhibited more so in relationship to lactate clearance. It was observed that there were individual improvements in time to exhaustion and MAOD after caffeine supplementation. These same participants that showed improvements also showed that they trained harder. This was evaluated in a questionnaire. The same participants trained up to 8 hours or more per week, including anaerobic activity up to high intensities, whereas the remaining participants trained 6 hours or less at moderate intensities. Research has shown that well-trained participants showed greater improvements after caffeine supplementation, and the observations in the present study support this theory. Findings of the present study conflict with existing MAOD studies. The existing studies use male-only participants, whereas the present study uses female participants also. Research has shown that there are gender differences for anaerobic capacities, so this may have had an influence on our results. Existing studies also use well-trained participants. The present study used participants with varied training status. So in conclusion, caffeine does not have a performance-enhancing effect on short-duration, high-intensity exercise in the present study, and the findings conflict with the existing MAOD studies, although we have identified possible reasons for this. The observations in the individual improvements show that there are possible benefits of using caffeine for anaerobic trained athletes. Findings in the present study could be beneficial to athletes considering caffeine supplementation. Specific anaerobic training may be necessary to benefit from the positive metabolic effects induced by caffeine, but this knowledge allows athletes and coaches to go out and implement training strategies to optimize caffeine supplementation. Thank you for listening to the presentation. That is going to have to do. You've got enough there. Now we've got to try and do the other one.